people, that if you are getting a transgender identity card or a certificate, then you can definitely ask for temporary, shelter home. You can ask for educational scholarship. You can ask for now also even this transgender, Ayushman Bharat TG Plus cards, that are health insurance card, that's also cover the gender affirming care, all these things. So our government is doing very, very good job, all these things. But the thing is that whether we know all these things, whether do you have that much of awareness that even you are working for the transgender committee, for example, then definitely we should help them to get their name uh, 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 registered in that portal so that they get all these services. Yeah.
Absolutely. And you know what you have told, it's really because I am aware of this, I am dealing with this. Even I was not aware that these type of things are there. And it's a wonderful because even the third gender are getting an equal opportunity. So definitely, yes, it's really wonderful that you have bring out a very, very important point. Now, uh, when we are talking about health, after that, the main problem which I feel, है ना, is somewhere the STDs and HIVs are more common in these marginalized groups. What my interpretation is there. So, because you are associated with that, you are advisor in the Great Alliance organization. So, just what's your view in that? The number one. Secondly, is the treating of those infection in those groups are same as when we are talking about the others like male or female or the other genders per se. Yeah.
Okay, so the thing is that actually, and also I'm coming to your question, but before that, I actually forgot one more thing to, you know, give you information on. That is gender affirming care, which you used to note. हम लोग पहले जिसको बोलते थे किसी ने sex change किया. Now it's known as gender affirming care. It's a package of like when the trans man or trans woman go through these processes, it can be hormone. Replacement therapy. Now we known is that gender affirming hormone therapy. Also like surgery, like d- if I talk about genitals re- reconstruction, there are facial surgeries. There is like voice therapies. All these things are part of gender affirming care. And we also have a guideline on this. It's called Standard of Care version 8, published by WPATH, World Professional Association for Transgender Health. If you go through the Transgender Act, there also it's mentioned by the government that the all the healthcare sector, they have to follow. If they have to take care of the transgender people, they have to follow this guideline. And like to give one additional information. At Alliance India, we are closely working with AIMS Delhi, All India Institute of Medical Science, and we have a help desk there. There we are helping our transgender brothers and sisters to get this facility. I mean, since last year, we have been able to help like more than 180 transgender people on, I mean, who wanted to, go through these services. And why I'm giving you information, I feel this should not be missed, that because self medication is a very dangerous thing. So if I'm a transgender person, I can see there's another trans person who is taking some kind of a hormone without going through proper endocrinologist or the proper medical track testing and everything. If I take decision on my own, it harms my body, and it does. So that's why I think whenever if we are think about some kind of a like change, bringing change to our body, definitely we have to think about the particular medical expert to uh, go for. Now coming back to your question. Now people, I was actually telling you that people who are into like marginalized um, groups or community, if I talk about LGBTIQ people, sex workers, there is already a stigma, right? Even like I can give you a couple of example also, because time to time we have to interact with the community, we have to do some kind of a uh, different research on these areas as well. So even after all these things, I mean, yes, things are changing, but there are still, I mean, healthcare sectors. I mean, if I'm a like sex worker and I have got this information from someone, I'm not naming anyone. If I'm a sex worker and I'm going to any kind of a healthcare system, the person who is supposed to give me care, he suddenly asks me, "Oh, you are a sex worker. What is your rate? When do you do sex work?" So things like this. When people know that you are in a difficult position, not all of them, but some of them take to get that advantage as well. And the thing is that it's not happening only for the people who are in sex work, but people living with HIV. They are also facing lots of stigma. And definitely, I should advocate on another thing. Yes, there very recently there has been a like decision given by the Delhi High Court. I mean, you have maybe seen that people who are living with HIV considered with that people who are with disabilities. That is absolutely wrong. Okay, if you go through the HIV/AIDS Act, there's an act in our country as well. That was in came in 2017. Yes, it's a very bold act talking about there should be no discriminations against the people affected or affected by HIV. So even after having that bold act, how Delhi court can take this decision, I'm really really very surprised, because there are so many organizations like us who are working in this field, involving the community, and for the community, definitely we have to, this is a very critical setback for us. So this is another area. I think it should be changed absolutely. And coming to the healthcare part, actually, I think as a healthcare provider, one thing I should definitely try to talk about that: please don't be judgmental. Please don't be judgmental. You maybe have your misconception or anything, something like that. And but simple, if you are really going to give that proper care for someone, suppose you are a doctor and I'm a transgender person, I'm coming to you as a patient, okay, and you don't know my preferred gender role. You are addressing me, Mr. You are addressing my pronoun as he. Then definitely it will be a shock or sad thing for me. I will not come you to you for the second time. So I will like isolate myself even there is service available. So this is a part. So I think there I would like to give an advice. If you do not understand someone's like gender identity, whatever, for your documentation purpose, maybe simply ask them that, may I know your preferred gender role? Do you have any other name m- behind your official name? How I can address you as he or she? These will make like fill the gaps, and definitely I will be very very much happy. People will be very very much happy, because when you do not have that, communication is a very important thing, right? We even says that silence is the best communication, but the communication can do miracle things. I mean, if you are a caregiver and you are very well known theoretically at your field and all these things, but you are very poor at communication, that is not going to solve the purpose. So definitely we have to improve our communication. I mean, how I can give the service and all these things. All those things are written in your medical books, medical guideline, that if this is the disease, give this kind of a prescription. But even beyond that, as a human being, as a caregiver, how you are behaving with someone, how you are showing minimum respect to someone, that actually matters a lot for these people who are already marginalized. I think that is the part definitely I would like to uh, give emphasis on. Yeah.
Absolutely, very correctly said. And major problem which as a gynec or as a doctor, what we are thinking that probably when we are seeing the patient of the marginalized group along with the normal, they are also normal. I mean to say the normal gender, the male or the females, probably they are not comfortable. What our feeling is that, and probably the third gender will be not be comfortable, or the male or the females, the other are not comfortable. So this is one thing which we always have in mind. But you have correctly said that creating awareness is very important. And don't be judgmental first. And secondly, don't be assumptive. You don't assume that. Please be frank and ask them. Probably that will be open up a window of talk between you to the healthcare provider as well as the healthcare recipient. And then definitely probably they will be very comfortable to tell their problem, with the healthcare provider, and it will definitely solve the problem much more. So it's very correctly you have said. And so we are talking about the doctors. So let as a working for the rights of marginalized group, I just want to ask you what your views, what you want that we doctors should do this so that it will help to those peoples which are often neglected. Yeah.
Absolutely, absolutely, absolutely. See, the thing is that nobody is perfect. That is the first thing I will like to tell you. Nobody is 100% perfect. And I was telling you that life is a learning process. So entire life we are learning, then there is no interfering. And there is no shy. We don't have to feel shy. Definitely, everybody is not expert on every topic, right? Everybody has his individual area expertise. So as a doctor, definitely as a medical caregiver, you are an expert, definitely. But yes, if you have to, see it from the lens of humanity, from the lens of equity, mutual respect, that is very, very much important. Otherwise, you can't, can't treat your, individuals or patients, whoever is coming to you. So I think that is